I'm your host, Alicia, and I'm so excited to have you listening in and joining in on the premiere episode. I've been thinking about creating a podcast for months, and with Gemini season commencing, it only feels right giving birth to my podcast at this time. This podcast is a platform for me to vent, share unconventional ways of thinking, provoke new ways of thinking in listeners, and simply be a way to connect with people with similar vibes. Topics will range from current events in society, spirituality, psychology, relationships, and many more. In today's episode, I'm going to share a piece I wrote a few months ago about the pandemic. It really challenges the privilege which is associated with the narrative of the pandemic, stating home being a place of safety for all people, as home may be a hell for some of our most vulnerable populations of people. I do want to drop a trigger warning, as I will be discussing some serious issues, and though I don't go into detail and try to remain as objective as possible, I do understand that the content may trigger some, so please just be mindful of that. And without further ado, I will share my piece. The piece is called "A House is Not a Home." With the slogan "Stay at home, stay safe" being a pivotal mantra since the start of the pandemic, this slogan lacks inclusion as it does not reflect the reality of individuals in marginalized communities experiencing mental health, addiction issues, and intimate partner violence. The same COVID-19 restrictions and lockdowns enacted to protect the public has also widened the gap for the vulnerable. For some, 2 meters apart has been the cause of their 6 feet under. An over-reporting of new COVID-19 cases, vaccination rollouts, and new strain variants bombard broadcasting stations. However, there's a failure to publicly cover the rise in domestic assault calls, overdoses, and mental health concerns as a result of pandemic restrictions. The pandemic is negatively impacting mental health, as 40% of Canadians have reported a decline in mental health since last March, with the deterioration more pronounced in those who are unemployed, those with pre-existing mental health issues, younger people ages 18 to 24, Indigenous peoples, those who identify as LGBTQ2+, and those with a disability, as reported by the University of British Columbia. 10% of Canadians reported experiencing recent thoughts or feelings of suicide. This is an increase of 6% in the spring and 2.5% throughout pre-pandemic, as reported by the University of British Columbia. According to the Center for Suicide Prevention, the psychological and social effects of the pandemic will continue for months and even years once the pandemic ceases. The pandemic has breeded an environment of social isolation, anxiety, fear of contagion, uncertainty, chronic stress, and economic difficulties in the general public. These feelings may lead to or onset depression, anxiety, substance use, and other psychiatric disorders, especially in vulnerable populations, including individuals with pre-existing psychiatric disorders and people who reside in COVID-19 hotspots. Stress-related psychiatric disorders, including mood disorders and substance abuse, are closely linked to suicidal behavior. The Center for Suicide Prevention states, and I quote, "The COVID-19 crisis, including suicidal behavior, are likely to be present for a long time and peak later than the actual pandemic." The data available on cases in suicide is currently premature. However, a study conducted by the Lancet Psychiatry analyzed suicide trends in the early months of the pandemic using 21 countries. The sample consisted of 16 high-income and 5 upper-middle-income countries. This study is unique as it is the first to examine the relationship between suicide increases and COVID-19 in multiple countries. The statistical evidence concluded a decrease in suicide in 12 countries versus an increase as projected. Of the Canadian provinces included in the study, Alberta and British Columbia both showed a decrease in suicide rates. No changes in suicide since the start of the pandemic may be attributed to a variety of factors, including the study being conducted very early into the pandemic, protective measures in place to support at-risk individuals, government economic support initiatives, failure to observe effects on low-income and lower middle-class countries, and data quality used. The authors also caution the importance of continuing to monitor suicide trends, as the effects may continue over time, and this study does not take into account the mental implications of the overall pandemic. Canada's opioid overdose crisis continues to worsen, as the pandemic has spiked the number of opioid-related deaths, hospitalizations, and emergency calls. In Ontario, an estimated 50 to 80 people per week are dying of overdoses, representing a 35 to 40% increase in comparison to last year since the onset of the pandemic, as reported by the Canada Press. The factors fueling these increases include border closures have affected dealers' supply of drugs, resulting in dealers adding in more toxic fillers to stretch the product. Access to services such as doctors and supervised consumption sites has been modified or limited. And social isolation fuels an environment to use illicit drugs to cope even in previous non-users. Social isolation also makes drug use even riskier, as in the event of an overdose, users may die alone or be found past a short window to avoid any major health implications. Canada's assaulted women's helpline nearly doubled, as 20,334 calls were received between September 1st and December 31st, 2020, compared to 12,352 over the same period the previous year, as reported by the Canada Press. When analyzing these numbers, it is important to consider intimate partner violence is historically underreported, meaning the numbers may be even higher. The alarming rise in these numbers can be attributed to individuals being in frequent contact and more isolated with their abusers. Previously, individuals experiencing intimate partner violence could leave the home more autonomously to attend school, work, community resources, and gain support from family and friends. In addition, an abuser's frustration due to job loss, pre-residing mental health and addiction issues are also triggers for abuse to escalate. It is important to consider the privilege that is associated with safety at home, as this is not a reality for all Canadians. And this is the end of my piece. I encourage you to further research this information if this is of interest to you. I think it's very important to give an alternate perspective, and I want to remind you to always keep an open mind and take nothing at face value. We live in the information age, and in order to not become easily swayed or manipulated, it's really on us to do our own research and exercise critical thinking. This commences today's premiere episode. Thank you so much for listening, and I'm looking forward to sharing future episodes and content with you. Have a great day, everyone. Bye-bye.